folks, welcome back to the reading room. I wanted to talk a little bit about this dog here who's presenting for swelling and a draining tract over the sternum region. And so radiographs of the thorax were taken to further evaluate that. There's a couple things to note here. The primary lesion is centered here at the third and fourth sternebrae, where we can see that there is irregular margination of the sternum itself and of these sternebrae. So we've got osseous proliferation along the ventral margin, along the sternebral end plates, and there's collapse of this intersternebral space between the third and fourth sternebrae. A little bit of soft tissue swelling that subtly extends dorsally there, and we can start to see some of that soft tissue swelling that's noted clinically along the ventral margin here, kind of up to window level to be able to see that really fully. Another thing to note is that in this nicely positioned ventrodorsal projection, we're not actually seeing much of the sternum at all. No matter how hard we window level it, it's really challenging to identify that when it's nicely positioned, and that's because there's superimposition of the vertebral column with the sternebrae and also the cranial mediastinum up there. It can be very challenging to actually identify. So our lateral projections are going to be best to identify that, but it doesn't mean that we shouldn't take orthogonal projections to be able to fully identify everything going on. Another thing I just wanted to point out was some of the changes to the pulmonary parenchyma here. So these radiographs are actually a little bit overexposed. So if we reset our window level here, we can see that this cranioventral pulmonary parenchyma is a little bit overexposed. If we window level that, we can bring back most of that, and that's because of the dynamic range of these radiographs and the exposure latitude there. However, we still lose a little bit of this along the margins of the cardiac silhouette where we're not fully getting it. So that's something important to note, and really be judging our radiographs to be sure that they are appropriately exposed, that we're able to see the pulmonary markings out peripherally as well. So this is an example of Sternebral Osteomyelitis. This is an aggressive lesion of the sternum, and this has actually been caused by a penetrating injury. It turns out that this dog actually got into a run-in with a porcupine about a year earlier, and so this has been setting up shop for quite some time. Probably a portion of or an entire porcupine quill has migrated up into this region, and that's something that we can sometimes identify as osteomyelitis secondary to these migrating foreign bodies. Sticks are another one that can cause this. Grass-ons, depending on where you are in the world, are definitely things that we can see causing these lesions. So we're oftentimes unable to see those foreign bodies radiographically, and that's where CT comes in as a next step diagnostic for these patients. We need to do that to further identify the change. So sternebral osteomyelitis, and I hope this has been helpful.